My name's Claire Sampson. I'm head of our statutory send services. Some of you might have come across me, might have seen my name already. I've been in post round about 18 months now, but I have worked for Nottinghamshire County Council for I think about 25 years. I'm a qualified social worker. My background is working in children's services right across the different teams. Um, so I'm really pleased to welcome you all here today. Um, so we've got a few slides this morning. I'm just going to talk a little bit about how the briefing's going to work. We're hoping that the session will last about just about 30 minutes, and the purpose of today is for your new team within our new statutory send service to introduce themselves. We haven't got all of the team members here, but when we get to Holly as the team manager, Holly can explain sort of who's here and who's not and why. We weren't sure about how many people we would have joining us. We do appreciate that the briefings were quite short notice. It was a tricky decision for us. We spent a lot of time thinking about whether to give people more notice, but we were also conscious that once the letters had gone out to families, that we didn't want to kind of create more anxiety that might be around by having a really long period of time between the letters and the briefings. So that was the reason why there was such short notice. But also, we have said really clearly that we are recording the briefings today, and these will be available for people who weren't able to make it. And also, if the feedback that we get is that people would like us to put another one on at a later date, there's absolutely no reason why we can't do that. So we'll be more than happy to. Because it is an open briefing to all parents, we've got to be a bit mindful of confidentiality, and we weren't actually sure how many people would attend. So for that reason, we haven't got a chat function today, and we haven't kind of got a raise your hand function to verbally ask questions. But what will be available throughout the sessions is the Q&A option. So if you look at your toolbar along the top, you can see that there's a Q&A tab, and if you open that, throughout the time that we're talking, you can type in your questions. We will try to answer as we go along. Holly or Louise or one of the team members might put an answer directly into the Q&A if they can, but also there's time at the end for us to look at some of those Q&A questions, pick up the most frequently answered, and we can answer those verbally at the end. Following the session, or following all of the sessions with all of the teams, what we'll do is we'll look at all of those questions that are in that have been put in, and we'll put together frequently asked questions. So those ones that are coming through frequently, we will put them together so that we've got a frequently asked questions document that we can share with everybody. We're asked that we're all respectful when we're asking the questions and supportive of each other, and that we value each other's contributions. So that's our contributions verbally, but also those being put in the Q&A function as well. I think somebody's got their hand up at the moment, but like I said, you're unable to here. So if you wouldn't mind putting whatever it is that you want to say in the Q&A, then Holly or Louise will pick that up for me. Okay, so what's happened so far? So you should have all received a letter last week, and by the virtue of the fact that you're here, we're making that assumption that you did do, with an invite to the briefing today and a copy of our new structure chart. We've had lots of feedback already. We recognise that there were certainly some issues with the initial letters that went out to Ashfield first. But what we did is we listened, we looked at that feedback, we read those emails, and we tried to rectify some of those issues before we sent out the rest of the letters. we have had some feedback. Some people have felt that the letters were very generic and not personal to their child or young person. And I think I just wanted to clarify that the reason for that is because we were sending the letters out en masse to all parents and carers because we wanted people to receive them around about the same time. I think we managed to get all of the letters out to all of the teams over 2 days. So pretty much on Wednesday, Thursday, and Friday. Just for clarity or just for context, really, and you may or may not know this already, but we have got 6,291 children currently with an education, health and care plan in Nottinghamshire, and about 795 children and young people who are open for assessment. So we were kind of managing trying to get about 7,000 letters out to parents and carers over a very short period of time. We have tried to respond, as I've said, to as many individual questions as possible, either by email or by returning phone calls, and we'll continue to do that to the best of our ability. But if you still don't think that you've had the correct information, or you've got a question, I'd ask, could you just please contact your team on the team email address that's been provided, and we'll follow that up and make sure that you've got everything that you should have had. Okay. So just a little bit of context in terms of the redesign and the restructure. So I'm sure that most of you will be aware of this information, but just to kind of recap, we had our Ofsted inspection in January 2023, and we were quite clearly told that there were priority areas that the local area partnership, which is health, education and social care, needed to address urgently. Following that, we had our monitoring inspection in July 2025, which is where Ofsted come back to check our progress against that urgent action that they asked us to take. And we were told that we were making effective progress. But I want to be really, really clear that for us, we still recognise that there's a lot more for us to do for your children and your young people and our families. So the redesign comes out of those two inspections really, and it's a result of a piece of work that's taken place over about 12 to 15 months. It's included extensive consultation with staff and professionals right across the system, so with our schools and education providers, health professionals and social care. And we've also had input from expertise from independent SEND consultants to help us construct our model. It's also in response to your voices and the voices of your children and young people. And we've done that through the numerous information that we've had from yourselves over the last 2 to 3 years through complaints, appeals, tribunals, surveys, different pieces of co-production work and feedback. And it's in response to those key messages that have come through to us time and time again through those methods of communication. I think we absolutely accept that it's taken us a bit longer than we would have liked. And I know that we've had some feedback around that. But I think it's been really important for us that we really wanted to get it right, and we want it to be a success and to make a difference. So just before I start to talk a little bit more about the detail in the structure, I think I just wanted to kind of to go through some of the underlying kind of principles and what our vision was in terms of the redesign and the structure. I think absolutely key to this and fundamental to the reason why we did it was because we want to improve the experience of our service for you and for your children and your young people. And we recognise that our response to yourselves and our communication has not always been as good as it should have been over a period of time. So that has been one of our priority areas for focus in terms of the way that we've restructured our services and our team. We're really focused on a more relational approach. We want to build really strong relationships with you and your children. and also with other professionals so that you and your children get the right support at the right time. We've focused on a localised approach, particularly in relation to our plan and review teams, and that's about us so that we can know our local areas really well and have strong relationships, particularly with our schools and with our education providers that are so key in relation to your children and young people getting the right support through their EHCPs. We've got dedicated teams with a focus on assessment, and that, together with the localised approach to the long-term casework, is to help us and our teams to really focus on specific areas of work. So the aim around that is for us to improve the timeliness in terms of our assessments and our annual reviews, as well as the quality. So the thinking behind that is for our workers, if you've just got one area of work to focus on rather than trying to juggle lots of different things and competing demands, then you're going to be able to do that piece of work much better and much more efficiently. We recognised that in Nottinghamshire we have a growing number of children who have EOTAS included in their education, health and care plan, and that some of these children, for some of these children, EOTAS is not always the right thing for them, and that they have that they want to get back into a mainstream setting. So we've got a focused team to be able to provide a more consistent approach and oversight to that particular group of children. Those children also don't get the same oversight from an educational setting as our other children do who are in our mainstream schools or in our special schools. So this enables us to be able to give a more focused approach to those children and young people. We've done a lot of work behind the scenes in terms of our processes to try and make them more effective and efficient. We've done some work in terms of improving innovation in the digital space to make us, again, more efficient and more effective and to be able to provide a better quality service. And we also wanted to, as part of this process, give a more doable day job for our staff, because if our staff have a more doable day job and something that they feel that they can be proud in and do better, then they'll deliver a better service for you and your children. So just to talk a little bit more about the structure before I hand over to Louise and Holly and the team. And please put questions in if I don't answer them here, because I'm so familiar with this structure. I've been talking about this structure for such a long time that I might make some assumptions that you perhaps want a bit more explanation around. But what the new structure does is it really sets out clear lines of accountability, starting with myself at the top, if you like. Clearly, we have Peter McConaughey, who's the Director for Education, who sits above me, and then our Director for Children's Services, Anne Coyle. But primarily in terms of our statutory SEND service, the sort of the accountability sits with me as head of SEND. Underneath myself, I've got 3 service managers. Louise is with us today and she'll introduce herself shortly. So Louise and Rob Briggs have got key responsibilities for all of our plan and review teams. So there are 7 plan and review teams, and we've split those into what we've called North and South. And Louise has got responsibility for the South teams, which includes Broxtowe, Rushcliffe, Gedling, and Newark. Nod, Louise, if I'm right. Thank you. And Rob has got responsibility for those teams in the north, which are Bassetlaw, Mansfield, and Ashfield. Our 3rd service manager is Louise Wright, and Louise has got responsibility for our assessment team, our EOTAS team, and also our SEND Education Pathway Officers team, which is a mouthful. Our SEND Education Pathway Officers are our early help workers. So we've increased the capacity of them, and there is 1 in each district. And they're primarily to work with those families who have perhaps applied for an assessment and we haven't agreed to do one at this stage, but looking for that early help and intervention for families before they move into this statutory process. Each of those teams have all got a team manager. Holly's the team manager for Gedling, plan and review team. And then underneath the team manager, we've got a number of EHCP practitioners and EHCP assistant practitioners. The EHC practitioners have the key accountability in terms of your children's plans, delivering what's in the plans, making sure that we hold the annual reviews in time, working with our professionals and partners in the locality area, and ensuring that your child's needs are met through your plan. And the assistant practitioners support the practitioners to do that. So they might do some of those more administrative tasks that mean that the practitioners can really spend time making contact, building relationships, and working with families and other professionals. In terms, I'm going to focus then now on our plan and review teams rather than go into any more detail in relation to the other teams. But if you're interested in the other teams, we will put some information on the local offer so that people can look at all of the teams in detail. But I'm sure you're more interested in the plan and review teams for the purposes of today. So we've adopted what at this point in time a sort of a model whereby all of the children within the plan and review teams will be allocated to the team. What we want, our aim is for the team to be available to you. We want to be able to be responsive. So we're going to be able to answer the phone when you ring. We're going to be able to respond to emails. The team will get to know your children so that even if you're not able to speak to your allocated practitioner, the team will be able to respond to whatever it is that you're ringing in for and be able to answer your questions or direct you to the right people so that you feel that you're getting the support that you need when you need it. We aren't going to allocate all children in plan and review teams with a worker at this point in time. We feel that there are a large majority of our children and young people who have education, health and care plans who are doing really well. Their schools manage their plans and their annual reviews without needing intervention from ourselves. And they just need occasional support from us, advice, directing into the right person to talk to. By doing this, what that means is that those children and young people who do need our intervention and do need us to work with them at that point in time, such as those children and young people who are going through key transfers, those who might be having difficulty in their educational setting, there might be a risk that that setting's not working for them and we need to look at something different. Those children will have an allocated worker so that the workers can really focus on working with them at that time and trying to find a successful outcome for them. We appreciate this is different. It's a different model, and that some parents and carers might have a little bit of anxiety around that. I think what I want to say really clearly is just because this is how we're going to try doing it at the beginning, we're not wedded to that. If it doesn't work and the overwhelming feedback from parents and carers is that this isn't working, we're more than open to look at it again and to rethink it. But we feel, and this from the evidence and the work that we've done, that this really is the best use of our resources and the most effective and efficient use of our resources. And so we will so that's the model that we've opted for at this point in time. So I think that was all that I was going to say for now. So what I'm going to do now is I'm going to stop sharing my screen and I'm going to hand over firstly to Louise to introduce herself.
Thank you very much, Claire. Good morning, fellow Gedling residents, because yes, I live here too. and I am part of this community. The thing about teams, particularly when it's like this, is I can't see you and I can't feel the room. So I have no idea what your perceptions are, what your reactions are. But we have to do it in this format. I will only say a couple of very brief things. You will have had very different experiences up until now. I cannot know those, and I cannot live or unlive your experiences. What I can do with this great team that we are developing is try and shape the future of our relationships. And the word relational relationships is big, but perhaps the key thing about relationships is that it takes two. Sometimes it takes more than that, but it takes at least two to work together collaboratively and in partnership. This team, we are committed to doing that. But just understand, if you can, this is a big process. It will not happen overnight, but we are committed to making it happen. I won't tell you much about myself, other than I live in Gedling. I'm very old, and I am passionate about outcomes for children, young people, and families. And that is what makes me still do this job. And I really hope we will get to know each other as this journey unfolds. I'll pass you over to Holly.
Hello, everyone, and welcome. Big hello from me. A lot of you probably already maybe know me. My name is Holly Peacock. I've been around in the service for coming up to 25 years now. So that's why probably most of you maybe know me in some capacity. I've got a various background, and I have worked in the Gedling area before in a previous role when I used to work for support to schools and families specialist service. I was working in the early years, so I used to do a lot of portage. So I used to bring a lot of bag of toys to young people's homes that were probably from 0 to 5, birth to 5. We used to do the portage, so I came with my bag of tricks and monitored development and then supported young people into settings and schools. And so I did that, I think, for 8 years, and I covered Rushcliffe area, Gedling area, and I also did a bit of Broxtowe as well. After that, um, I became a project officer for stepping young people down from social care, so young people who had overnights. So I've got a bit of background in terms of short breaks and overnights. And then I came into what was when it was the Integrated Children's Disability Service when we merged with the SEND team. And I've been doing EHCPs and plans for goodness. It must be coming up to again similar probably 8 years. So I've been around, so to speak. And it's really lovely because a lot of those young people that I worked with from birth to 5, and now I was team manager for post 16 team. They were creeping into coming up to 16, which is quite scary for me, but it was lovely to hear how those young people were doing. So I'm team manager for Gedling area now, Gedling district. I'm really looking forward to getting to know the Gedling district and getting to know you all and your families well. So like Claire was saying, we're going to be trying to responding to where we need to respond. So a lot of the working young people who've placements at risk are key stage transfers. But I hope to be able to have a bit of time to be invited to those lovely reviews as well, where we hear how things are going well. So, and that we want to have more of a presence. So I think a lot of things since COVID have gone over Teams. I'm hoping to move back into doing meetings in person where we can, just because I feel it's nice to see people face to face and really get a feel from where your young people are at school, their environment, how their day to day looks. So I'm really hoping to get more of a presence. In the Gedling team, we're going to have 5 EHC practitioners and 1 assistant EHC practitioner. We've got 2 of our EHC practitioners here today, and they're going to introduce themselves in a bit. The assistant EHC practitioners here today. One EHC practitioner is off poorly today, unfortunately, Ellie Holmes. So some of you probably already met Ellie Holmes because she's an EHC practitioner who's been working for the service for a while, and she covered the Gedling area. So she's already heavily involved with Gedling area, knows a lot of the Gedling schools. So that's Ellie Holmes. And we have two EHC practitioners that are going to start with us. We've got the two that are starting with us is Vanessa Peacock. She'll be starting in 2nd of Feb. And we've also got Katrina Harper. She'll be starting in April. So, and I'll ask the other two EHC practitioners and the assistant EHC practitioner to introduce themselves now. So can Tegan and Lottie introduce themselves? I don't know, I can't see you on the screen, sorry.
Morning, I'm Tegan Tracy, so I'm one of the EHC practitioners for the Gedling team. I'm quite new to the team, been here since the start of December. I previously worked in a secondary school within the SEND team, so I've got a fair bit of knowledge. But yeah, happy to be working with the Gedling team. Looking forward to meeting everybody.
Hello everyone, so my name's Lottie. I'm also quite new to the Gedling team. I started at the end of November, so still learning a lot, but very excited to meet you all. Previously, I worked in a Derbyshire school as a teacher, but I'm finding this role really interesting. So yeah, I look forward to working with everybody.
Good morning, everybody. My name's Amy Mee. I've currently worked within the service for coming up to over 2.5 years. I'm currently the annual review service organiser, but I've been very lucky in gaining an assistant practitioner role within the Gedling team. I've worked quite a bit with all the Gedling school settings in the background, so I'm really looking forward to meeting all the parents, carers, families and working alongside with you all to get the best for your young people.
Yeah, so a very big hello, and we've established sort of you know, we're taking a lot of phone calls at the moment, trying to get to know you all. And as Claire said, we're hopefully going to be responding as and when you need us. So please do phone. You've got the email address and you've got our phone number. So yes, hello.
Thank you, Holly. Thank you.
Have we time to take a couple of questions, Claire? There's one I'm itching to answer.
Yeah, so I have answered the questions in the chat as we've been going along.
well done.
As in the writing questions, but that's fine. But I've seen, I don't know, there's a chat that has started, and I'm not quite sure how that's happened. So there is one.
I'll just take one very quickly.
Yeah, that's
and
fine.
that was somebody questioning, what about post 16? I can say to whoever asked that question, there is a lot of knowledge between Holly and myself about post 16 options. I've been in and around the world of further education for more years than I care to remember, and you will not be short of advice about options.
Okay. Thank you, Louise. Holly, could you just answer the question in the chat that asks about how many children and young people there are in the Gedling area? Have you got that number at the top of your head?
Yes, in the Gedling area, there's about 700, almost 800 young people in the Gedling area. I haven't got the exact number off the top of my head because I need to get my spreadsheet, but it's an ever-changing picture. We've got young people moving into the Gedling area. Also, we've got, as Claire mentioned at the start, 700 and something young people going through assessments. So once they've had their assessments and their EHCPs finalised, there's a bit of a handover between the assessment team and ourselves, and they come and join the Gedling district team. So it's an ever-changing picture, but I would say there's top end of 700, so I think it's about 780 something, but that could change day to day.
Thanks, Holly. Yeah, and just to clarify, yeah, that's with an EHCP.
Yes.
And we are now due virtually in Newark, I believe, Claire.
Okay, so Thank you very much, everyone, for joining. Like I said, this will be recorded. It will be available for people to watch, and also we will continue to answer the questions. We'll put together a frequently asked questions document. Yeah, but thank you very much. Thank you.